Hello and welcome to another edition of the Route 422 Business Advisor Show. And today we are at Yucha Medical Pain Management and Chiropractic Rehabilitation Center right here on 435 West Cedarville Road. That's the intersection of Cedarville Road and Route 100 in North Coventry. And we're going to be talking to some of the professionals at Yucha Pain Management and Chiropractic Rehabilitation. And let's start with introducing Dr. Louis Rosardi, your doctor of physical therapy. Correct?
Yes, that is correct.
Great. Dr. Rosardi, tell us a little bit about the benefits of physical therapy.
Well, physical therapy had multiple benefits. Mainly, a lot of people come in to decrease pain, improve functional mobility, basically return to what they're doing after injury, whether it's gardening, sports. Also, it's a great way to try to prevent or delay big surgery, like knee replacement, hip replacements. Hopefully, it's won't be as painful and more enjoyable than going straight to a surgery and potentially, avoiding that altogether and the side effects.
Sure, it runs the entire gamut of ailments and issues, and I guess it integrates well with chiropractic as well.
Absolutely.
So talk a little bit about that. I know you kind of cross paths a little bit in treating a patient with, say back pain, for instance.
Correct.
Right? But talk about the differences in how the two practices complement each other.
Yeah, I think overall we come from like two different categories or I guess mindsets on how to treat. One is more of manipulation, alignment, and physical therapy comes from like an exercise-based
and muscular-based.
Muscular-based, correct.
Mm-hmm.
So, I think it's a good combination because you're obviously bringing both angles and looking at the same patients. There's communications between us where you go to a different facility. Someone's like, my chiro did this, and my physical therapist did this. We can talk here and say, what are we doing?
You've got it all covered.
All covered, yeah.
Right,
so.
right. And talk about results you get. I'm sure you have some fantastic results, huh? All kinds of conditions.
There's some people coming in here on canes, almost in tears during the evaluation, and by the time they leave, whether it's a couple sessions or a couple weeks, they're walking without the device. They're happy. They might not be 100%, but they're to the point where they're happy, they're getting back to their activities. So
awesome. And a little bit of that is you cracking the whip and making sure they do their exercise at home, right?
Yes.
Right, very good. Excellent. All right, well, let's talk to Dr. Mary Kasherba, a medical doctor. And Dr. Kasherba, let's talk a little bit about how you integrate physical medicine into chiropractic care.
So bringing in medical allows us to integrate some services that complement the chiropractic care.
Sure.
For instance, we're able to order the physical therapy. We also can order some medications, and although we try to be very natural here, we have some really nice pain creams and anti-inflammatory creams that tend to work more directly on the area they're applied to as opposed to being absorbed throughout your entire body. We also have the ability to do some injections that might help with muscle spasm. We treat joints with arthritis, also some tendon and ligament sprains and strains.
Wow, quite a bit. And now the latest thing is medical marijuana, right? That's going to be very helpful in all kinds of conditions.
Yes,
right?
at the beginning of the year we added being able to certify patients for medical marijuana, and that's been really wonderful.
And it's relatively new, but I'm sure there's already a lot of research out there, which I'm sure as a medical doctor you're well up on. So it's pretty exciting new field, isn't it?
It's new again. Marijuana has been used for centuries and even prescribed by physicians up until the 1930s.
Oh, wow. Okay.
And then for some reason it was vilified.
Sure.
And I think we went to a lot of opioids, and now we have this huge crisis in America with opioid addiction.
Right.
So marijuana has been just wonderful for pain relief, for spasm relief. It's used for seizure disorders. It's used with Crohn's disease. Cancer patients, stimulates their appetite as well as helping them with pain and nausea. And we have just seen a really wide variety of patients and a lot of amazing benefits from that.
Wow, very interesting. Well, I'm learning a lot here today. Well, you guys have been very informative. Thank you so much. And let's talk to some of your colleagues now. But thanks for talking with me today.
Thank you.
Thank you.
And we're back now with the partners and owners of Yucha Medical Pain Management and Chiropractic Rehabilitation. I'm going to get that full name in there. To my immediate left is Dr. Randy Yucha. Welcome, Randy.
Hi.
And Dr. Rod Gable. Welcome, gentlemen. So, let's start talking about you've been here 30 years. You've been in practice 30 years, but now, of course, you're here at the location we mentioned earlier. But talk a little bit about this process of 30 years in business in this community.
Well, I'm from this area. I went to grade school, high school here, and went to chiropractic school in South Carolina. So always wanted to come back to the area and practice.
Right.
I started at the Coventry Mall initially for about 8 years.
Okay.
This corner property came available in 1998, and we've been here ever since.
Yeah, and I know I've written a previous article, cover story about you guys, and so, Dr. Rod, I learned that you actually came here as a patient, as a youngster, correct? And then you were inspired to become a chiropractor, and then came back to work with Dr. Randy, and now you're a partner in the business. So talk a little bit about how you got involved in this business.
Sure. So I've been a patient of Dr. Randy's since I was 12 years old, dealing with headaches and migraines, and my parents have been patients here for a long time. So not only is he a good friend of mine, but I think of him as family. But we have a similar background. We're both from the area, both really appreciate conservative care and giving the patients the best care they can possibly get.
Yeah. And so, yeah, you mentioned conservative care, and that's, you guys both really started as chiropractors, but the industry has really changed over the years, hasn't it, in terms of the range of services that you can provide to help your clients with their pain issues, and the practice has grown. So talk a little bit about how you've kind of evolved into medical pain management and so many different now options and modalities, and you even do things with cosmetic procedures, correct, and weight loss related procedures. So talk a little bit about the variety of services and how you've kind of evolved into such a expansive practice that you have now.
Okay. So for about 27 years, basically we had a chiropractic office that provided different types of adjustments to the patients, whatever they needed, in regards to. Also under our license, we're able to do different types of therapies, like pain relieving therapies, tractions, things like that. So approximately 3 years ago, we've had this in our, Dr. Rod, we've been together now here in the office for 7 years. Okay. A little hard to believe, we were just talking about that last night. It's been that long already. But what we decided, well, it was a thought process that is a complicated process to actually integrate of what we've done. Okay, so it's kind of easy to do the whole chiropractic office thing, but we're thinking about integrating medicine into the practice, pain management medicine. So we came up with the plan and integrated about 3 years ago. So when I say integrated, what that allows us to do, so we have a chiropractic corp and a medical corp, and basically we have a partner Dr. Mary, who was we talked to before. Yeah. She's a partner in the medical side. Okay. So she's our medical director. So all the medical part goes through a medical corporation, basically, the medical side. So as a chiropractor, you can't do the things that we do here without having a medical side to it. So basically what we're able to provide is pain management in regards to we don't necessarily manage like drug therapy, like narcotics and things like that, but we're doing large joint injections, trigger point injections, nerve-related type injections. People come in like with sciatica or some type of radicular symptoms down their arms. We're able to do that. We also have the ability to send our patients for epidurals and things like that to another office. We don't do that right now here. We have medical weight loss, which is an HCG, hormone-based weight loss that works amazing. It's just great. People see great results, 30 pounds, literally 30, 35 pounds in a month. Wow. We also have physical therapy now, like real physical therapy. So we have a doctor of physical therapy, Dr. Lucas, who was on a little earlier ago. And we have 2 PTAs that help him out with a variety of all types of physical therapy. Dr. Rod, he's going to talk a little bit about our in-house pharmacy, and so talk a little bit about that.
Tell us about that.
So with regard to conservative care, our in-house pharmacy allows us the ability to give different types of pain relieving topicals. So people are not taking oral medications, they're not taking 6 Tylenol a day, which we hear sometimes, but you can still get the exact types of relief by putting things on locally, which really helps the patient when they're not here in the office, or if they're in the really acute stage. So it's just another thing that we can give our patient, and I think our philosophy is to give our patients as much as they possibly can get to get better faster. We're not directing them in one direction or another one. You know, it's really about the integrative model that I think gets people better faster. So in addition to that, you know, we try to allow for people to help themselves by supporting them when they're not in the office with different types of low back supports, different types of neck collars or knee braces for osteoarthritic pain. So it's not just coming in getting treated. There's a lot of things that they can use at home, which I think they appreciate, and it certainly cuts down the cost of continually having to come in and pay a copay and things like that.
Yeah.
So the other thing is with the bracings, it's a lot different than just going to a pharmacy and buying braces that you don't really know what you're doing with the braces. So the patients are instructed on how to use them for pain control. We also do TENS units. So we just have a lot to offer, and patients love it. They love staying in-house for all the services that we can provide. Makes it much easier and also much more controlled.
Wow, so it's really become a truly interdisciplinary approach to pain and dysfunction, and comprehensive. It's like having all the tools at your disposal instead of being forced to work with just the basic tools. Is that a good analogy?
Absolutely.
Good.
Exactly.
Well, I know we're almost out of time here, but it's just the latest tool that you've added to your arsenal to help people is hearing aids. So tell us a little bit about this, your hearing aids you're going to start going into.
So we have a new business here. It's called Yucha Hearing Aids.
Okay.
My wife is actually involved in that part of the business.
Okay.
My wife has been a speech pathologist for almost 30 years, retired from the school districts, and is now a fitter apprentice. So that means that she's able to fit hearing aids. We also have a audiologist that's here 3 days a week. So we have the business that just opened approximately 2 months ago. We felt like it was just another avenue to help patients. You know, hearing loss has huge impacts on people's lives and really on their health too. So it just felt like a really nice match.
The next step for you guys. Yeah.
Yep.
Perfect.
Yeah, so that's
Perfect.
what that's about.
Very, very impressive. Well, thanks for talking with me today. It's really very educating to learn just how many ways that you can help people with their problems. So I would encourage our viewers to check out Dr. Randy and Dr. Rudd and check out the website, which is yuhamedicalchiro.com, and we'll put that on the screen for people, right?
Okay, terrific.
And if
Yeah.
people want to get in touch, it's 610-326-2706, right?
Correct.
Great. Well, thank
Thanks.
you for talking to me today. And thank you, viewers, for checking out another version of the 422 Businesses Show. And for you business owners who do not receive the 422 Business Advisor magazine, please go to 422bizmag.com, and you can subscribe there and get your free issue. Thanks so much, and we'll see you next time.